Let's go deeper into this discussion tonight with Dr. Lipi Roy. She's certified in internal and addiction medicine. Dr. Roy, a lot of people dying, they do not know they are taking fentanyl. They think, all right, I'm logging on, I'm buying Valium online, and then they're dead from one pill. Fentanyl testing strips, they're banned in half the United States. Should they be legal everywhere just to test?
Well, first of all, Chance, it's so great to see you, and I'm so grateful to you and Newsy and your entire team talking about this very important, frankly, public health emergency, which is the drug overdose crisis. Rates were going up before COVID-19, and during the pandemic, we know that drug overdose deaths have skyrocketed. In fact, in 2020, there were almost 100,000 drug overdose deaths, and fentanyl, or illicitly manufactured fentanyls and other synthetic opioids, were involved in over 60% of them. I am all for, as you know, I'm an addiction medicine doctor, also an internal medicine doctor, and these are the patients that I see. I treat men and women who are experiencing various addictions to various substances, from alcohol to opioids. And the truth is, the current drug supply that's out there, whether a person wants to take heroin or not, maybe they're using stimulants like cocaine, it's all cut with fentanyl. And fentanyl is so potent, even a small amount can drive somebody into shutting down their breathing and causing an accidental drug overdose and death. So I am all for anything that's a harm reduction strategy to keep people safe. And that includes fentanyl testing strips, Chance.
I know you said it's a public health issue, but you probably already know the pushback. Give me your take. When people are saying, wait, my city can't fix the potholes, but they can buy drug users special testing kits. How does that work?
Yeah, I can see why people are struggling wrapping their heads around this concept of harm reduction. A lot of the pushback that people in the harm reduction field have received for decades is that when you implement harm reduction approaches, which ultimately keep people safe, people think, oh, you're enabling their drug use. The reality is that a person has the right to use whatever drug they want. My job as a doctor is to keep them safe, right? Just like I can't tell you to stop eating a bag of chips, or I don't want you to tell me. I mean, you have the freedom to do so, but I want you to do so in a way that's safe. So people are going to use, and when they do, let it be a safe supply. Depriving them of fentanyl test strips and other harm reduction strategies is not going to stop people from using. So let's create a safe, compassionate, evidence-based public health environment to keep our loved ones and our next-door neighbors safe, Chance.
Is there one specific place you would recommend starting? Because policy-wise, we need to somehow get our arms around this, reduce overdoses. But at the beginning, we saw this as a prescription crisis, I'd say, right? And then it was, we have deaths of despair. Now we have random poisoning, essentially. So we have 4 problems at once. Where do we start?
Yeah, great question. It can seem quite overwhelming, right? So what I remind people is I bring it back down to the data, the science and the storytelling. When you combine these two, it's the only way to move the needle forward. The truth is, and we have plenty of the decades of data showing that anyone can develop an addiction or a substance use disorder or an addiction to gambling or other behaviors under the right conditions. So it's usually pain and trauma that are the underlying causes for most people who go on to develop an addiction. It is not a moral failing. So what we really need to do, Chance, is really increase education and awareness when it comes to addiction from the medical field and policymakers, judges, law enforcement, so that we are not using a punitive approach, but rather an evidence-based one. And that also includes increasing access to medications. So if it's somebody addicted to opioids, make sure they have access to Suboxone or buprenorphine, methadone, counseling, therapy, and other support systems. Some people just need clothes, socks, housing, education, all these things that we as human beings rely on. It'll go a long way in reducing substance use and addiction rates. That's what we need to do, Chance. And by the way, yesterday was National Fentanyl Awareness Day, so I'm really glad we're talking about this. I posted several videos on TikTok, Instagram, social media, on Twitter, so I encourage people to look that up to find out other public health strategies that we can use to keep people alive.
And by the way, really briefly, I don't want to overlook this other strain here. You were the chief of addiction medicine in New York City jails and Rikers Island. The other big culprit in deaths was meth. Meth.
Yes.
We know what this does to you at this point. People are well aware. Why meth?
Yeah, so it's interesting. You're right. We are seeing more stimulant use, specifically methamphetamine, in the Northeast. It's been in more popular use in other parts of the country. The short answer, Chance, is that when they're in despair for whatever reason, they're going to find whatever drug eases their pain and suffering. For some people, it might be methamphetamines. For some people, it might be heroin. My job as a doctor is to keep people alive and safe and just get them the help, the care, and treatment that they deserve and need.
Dr. Lipi Roy, thank you very much.
You're welcome.